with my history of, being in Boy Scouts and in the military, you always have to be prepared, right? That's the Boy Scout motto, and making sure that you're going to be able to do the best that you can. And one of the sayings that when I was with the Marines, it's, what happens when you make assumptions? People die, right? And so, not necessarily to say that that's what happens in dentistry, but you can make mistakes, right? And so, being able to integrate something like Yomi Robotics to basically plan everything out before surgery and then be able to execute it in a fashion that you want, to me has been invaluable. And it aligns with my core values to where I like to create a plan and then execute the plan, right? And so it's not to say that the Yomi doesn't work every time, but it works most of the time, right? Like I order all the parts and most of the time, 95% of the time, it goes to plan, right? And so that's what I really like about it. Yes, it adds a little bit of complexity. Yes, it requires training, but in my opinion, it creates better outcomes for our patients. So Yomi Robotics, it's robot navigation that's assisted. Okay, so you're still holding the handpiece, but it essentially locks you into place and doesn't let you deviate from your plan. It gives you the ability and the freedom of free-handed surgery, but it gives you the precision and accuracy of the surgical guide. You're able to do the surgeries just as accurate with a guide, but as fast as freehand, right? And so you're kind of getting the best of both worlds in that case. The nice thing is it does allow you to make call audibles and make changes if you need to during the plan. With the Yomi robot, you're creating this surgical plan. It basically executes that plan with you holding the handpiece, right? So, like I said, it locks you into place. It won't let you drill where you shouldn't be drilling. You stay away from nerves, stay away from sinuses. You can place implants flapless in some cases and be able to, perform alveoplasty that's predictable and is going to actually, be nice and flat and give you enough reduction and all those things. And it really is just the kind of the epitome of being able to plan prosthetically at the beginning of the workup and be able to have a surgical execution that meets that prosthetic plan. So, how does Yomi work with a free-handed doctor? What's really nice is that you're able to, again, schedule that plan. And with a free-handed doctor, you're basically going off landmarks when it comes to placing your implants. Well, the Yomi is showing you in real time what your landmarks are, and it's going to put that implant where you want it to go, right? And so the nice thing about Pathways is they teach you how to place via landmarks, but then you're able to put that into the surgical guide. Now, free-handed doctors are going to have to learn how to plan digitally, right? And so you need to be able to put it into the software, very similar to other, surgical guide softwares. And some are just used to just, looking at a CT scan and throwing implants in there. There is some planning that goes in advance, but the doctors that are wanting to be really, really good at freehand are already doing that anyways and already know how to, digitally put implants into a plan. And so it's just a matter of utilizing the Yomi software to do the same thing and then basically have the implants go where you want them to instead of just requiring your skill to do so. When it comes to the patient benefit with the Yomi robot, essentially you're going to get the efficiency of freehand, but you're going to get the accuracy and precision of guided surgery. And so what that means is you can be more conservative, you can be faster. And there's a lot of examples to where you can do, 12 implants in 45 minutes, something crazy like that. And it's to the patient's benefit, right? The faster the surgery, the better the post-op recovery. But in this case, we're also providing a ton of accuracy to this. And so patients are going to recover much easier. What's so important for Pathways to be at the forefront is they're teaching the fundamentals, right? And so the thing with the robot is it's not going to make a mediocre implant dentist great, right? It's going to make a great free-handed dentist and amazing, right? They're going to get the outcomes that they want. So it's really important that Implant Pathways was able to see this and realize that robotics is the future. I mean, the hospital setting is using robots daily, right? There's certain surgeons that won't do certain procedures without the robot, right? And so it's just a huge benefit, not only to those that are coming here to learn the fundamentals, but it's a huge benefit to those patients to know that they're going to get the right treatment. We give people the fundamentals, right? But now we give them the abilities to be even better and accelerate their career than say like someone having to, learn how to do it free-handed and do all that stuff for 20 years. We can really accelerate that growth and accelerate the positive outcomes.